All right, so we're recording.
Good
Are you
morning.
ready?
I'm always ready.
All right. Well, good morning. Today's Spotlight series is really a special one for me because I'm introducing someone who is not only an incredible, oh, I'm going to cry thinking about this, not only an incredible professional, but also my mom. She is my biggest cheerleader for as long as I can remember, and the person who has taught me hard work and perseverance. She also has inspired my journey in geriatrics as a physical therapist. She is also a geriatric nurse practitioner whose life mission has been to show people that incontinence is not a normal part of aging. Over the course of her career, she specialized in neurologic care for older adults and women and was the founder and director of a bladder clinic here in Western Michigan. Here, she was involved in groundbreaking work in urinary incontinence and pelvic health. She's written textbook chapters on incontinence and overactive bladder, published peer review research, taught and spoken at national medical nursing conferences all over the country. After a full and impactful career, she attempted retirement, but it didn't quite stick. She continues to serve older adults in assisted living communities because she believes that her work still matters. She's also been a patient at Vitality at Home because she knows firsthand what happens when people chalk real problems up to just getting old and why challenging that mindset is so important. She's inspired so much of the work that I do today, and I'm so excited for you to hear her story. Welcome, Mom.
Well, good morning, Jenna. That was something. I don't even recognize that person.
Listen, I thought it would be easier for me to get through, but I guess I'm still emotional about it.
Oh, I'm emotional as well.
All right,
So,
well, let's dive in. So,
okay.
can you tell everyone a little bit about who you are and how would you describe what you do?
Well, um, I am a geriatric nurse practitioner. And the way I got to this was, I will tell you, in my early career in nursing, which has been my only profession, I loved critical care. And I never, ever thought I would leave critical care or administration. And then, I had a recruiter call me just out of the blue, asking if I wanted to be a director of patient services in a long-term care facility, which was a continuum of care. And in that facility, it would have been in charge of nursing, physical therapy, social work. And I thought, oh, that's kind of different. And I had some other things going on at the time. And I just thought, I don't know. So they came back to me and said, well, we'll give you a $20,000 raise. I said, I'm in. So, I actually took a leap. I took a leap of faith in myself and I thought, I might like this. Who knows? I started my job. I just loved the older adult. I loved what they brought to the table. I loved their stories. I fell in love with the staff that took care of them. And I loved the job. Well, I had a very best friend who worked at the hospital with me and, coaxed her to come over with me to work, and she did. And we, of course, got snippy and decided that we were just going to quit and start our own business. We thought we could teach long-term care staff things that they didn't know and maybe didn't do as well as we wish they did. And, her mother was older. She was our inspiration. She passed away at 99. She still recognized me when she only saw me once or twice a year. She walked every single day. I remember taking a trip with her and I got up and wondered where she was. She was walking the halls in the hotel because we were going to be in the car for the whole day. I mean, she was amazing. Her mind was sharp and I contribute that all to her activity. But anyway, so we did this. We, instituted a lot of things in nursing homes, a lot of clinical care issues. And then I thought, I really miss patient care. So I went back to school in the early 90s and became a geriatric nurse practitioner. And that's what I've done forever. And like you said, I can't leave it. I don't know what's wrong with me, but you know, the older adult is very intriguing and very interesting and keeps me on my toes.
They sure do. So if someone met you for the first time, what would you want them to know about you? Not anything to do with your resume, but just about you.
I guess I would like them to know that I really care a lot about people, especially my family. And when I'm dedicated to something or somebody, I do everything I can to maintain that fandom. And this is crazy, but ask anyone. I'm a crazy sports fan, especially baseball. And I live and die with every win or loss, with my favorite teams. And you know that, my grandkids know that. And, as people get to know me, they know that as well, which is kind of funny, but my
I
thing.
love that. I love that. Yeah. All right. So let's get into it. How did you end up doing the work that you do today?
Well, the biggest turning point in my life was the death of my mother. And she was only 62. And I never really understood how and why she didn't want treatment for her ailments. She was very obese. And yeah, that changed my whole life, basically.
Yeah. So would you say that what you saw with your mom shaped what you ultimately ended up doing for work?
Yeah, definitely. I mean, I never ever expected to be in this position. I never expected to work with the older adult. I thought I'd be in hospitals forever. But when I saw her dying and, the shape she was in, etc., it changed my whole life. And at that point, I knew I was in the right place working with older adults.
Yeah. So that's professionally. How do you feel like that impacted you personally and how you view aging?
I knew at that point that I needed to maintain activity. My mother's obesity really bothered me. Um, I maybe became obsessed with maintaining my weight as an adult because in my head at 62, if I was obese, I was going to die. And, I just needed to make sure that that would not happen.
Yeah. 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 Um, all right. So clearly you've seen that work is very fulfilling for you. What part of your current work, I guess, both professionally and work that you do, volunteer work or other work that you do throughout your life, what feels most meaningful to you?
I feel like I make a difference in people's lives that I serve. I know I take too much time with my patients. That's a criticism of mine. But to me, it's time well spent. I mean, I'm not in it to um, have a paycheck every other week. I'm not in it to do anything but really take care of people.
Yeah.
And, you know, that's important to me.
Yeah. So just because I know you personally, I do know that you did take some time, you did retire and you took some time away. And just to be real, I do know that you felt like there was a piece missing, right? And what I'm hearing you say is that this work gives you meaning and purpose. So why do you think that purpose matters so much as we get older?
Um, Basically, because if you have no purpose, there's no reason to get out of bed in the morning. I was finding myself in my pajamas until 11 o'clock in the morning. That's disgusting. I know that. I was drinking tea and I kind of got out of my routine. I was
Sure.
just not happy. I I had some feelers out there, and so I started working on an app. I started this for urinary incontinence, and that really made me bring back everything that made me happy, everything that I thought I could make a difference in the world. I also was doing some research with another research company about a different device for incontinence. And all of that just led me back to, if you don't get up in the morning and you don't have a purpose, even if that purpose is, I'm going to clean out that closet in the front
Yeah.
hall,
Right.
you know, it, I don't know, for me, it didn't work. And everybody thought I was crazy to go
Yeah.
back to work. But, if you love something and you cherish it, I think you need to make time for it. And I
Yeah.
only work a day and a half a week, so
Right.
it isn't like I went full time. I have to have time for all my other stuff.
Oh, for sure. I mean, when would you watch your sports?
Right.
Right.
When would I
Travel,
go?
right?
Right. When would I
Yeah.
grab my grandkids? They're the ones
Yeah.
that keep me, you know, sane and keep me moving, you
Right.
know.
Yeah. Yeah.
So
So it sounds like grandkids are part of the answer to the next question, but what do you feel like keeps you energized and curious at this stage of life?
I think the most important thing is the progress my children and grandchildren are making in their lives. I remember being in my 40s and being so busy that my life was my priority, and in order to make life good for everyone. I hope I can get past this. I regret
Listen, if I got past the intro, you can get past this.
I regret some of that. Some days, maybe a lot of that. And I regret some decisions that I made, but I understood it. And I understand it still. I see that in my kids, but I'm also incredibly grateful that they are taking time away to be with their children and do it right. It just, I think you have to make that as a priority. And of course my work and what I'm able to work at, the puzzle of taking care of elderly people.
Yeah.
A plus B does not always equal C. There's a lot of challenges in long-term care. Um, Deprescribing is one thing that's come up, and for anybody who listens to this and is on a dozen medications a day, the federal government, CMS, has really come down on us and, requiring us to look at all the medications people are taking. But when acute illness collides with chronic disease, it's always an adventure. And I feel
Mhm.
like I'm just very lucky to have this opportunity.
Right. I think from a cognitive perspective, that piece of your work is invaluable, right?
Oh,
So you're having to stay on the up and up because medication recommendations are always changing. And I think that at least the push that we're seeing in the physical therapy world is, what can we do? What can we do to help these individuals that doesn't include adding on another medication, right? You had mentioned
correct.
deprescribing. Can you kind of explain what deprescribing is a little bit more?
Well, there's two components to it, basically. It's, looking at a list of medications that people are taking. I have people taking, new patients that I see taking vitamins, minerals. Um, I just had a guy who came in with a bag of 20 different things he was taking, and I asked why he was taking them. He had no idea. And so we did some lab work and reviewed with him. It's like, this is normal. These things are elevated. You need to stop this.
Yeah.
And, these things are on the low side. So you need to continue this. So we need to keep track of that. But the most important thing is the pain syndrome and the pain issues that people have that are on opioids, A lot of people are on anti-anxiolytic drugs, and those, there are other ways. And being a physical therapist and, working with older adults, that too many people just put medications against something that can be treated differently.
Yeah.
And I think we've overloaded our therapy people because, they can't always meet our needs right away. But,
Yeah.
it's just, diving deeply into why people are really getting these medications, and should we be looking at decreasing the dose or
Mhm.
eliminating the medication altogether?
Yeah, absolutely. And I know that we see a lot in our clients. We'll go over the med list with them and we find the same thing. They have no idea why they're taking what they're
Right,
taking. And
right.
the deeper we dive, you start to come across people saying, oh, well, my doctor prescribed me this. And then I came back because it was giving me stomach issues. So then they prescribed me that. And then I
Oh,
came back because it was making me
absolutely.
anxious. And then they prescribed me that. And like the deeper you dive, the more you think, okay, well, you could have done something entirely different, or we don't need to give you all of this. Like when this symptom comes on, let's try this. When that symptom comes on, let's try that. So I think it's really a gift to the places that you're working right now, because in my experience in the long-term care realm, that wasn't happening. Those medication, we call them like black or brown bag checks, right? Where they put all their medications in a brown bag and then someone checks them and says, this is still working, this isn't working. So that hasn't been happening in a lot of long-term care facilities. So I think that the individuals that you see in the facilities that you work with are blessed to have you and to be able to get that done.
Well, thank you. I appreciate that. But I have to really give a shout out to my employer, who is Team Health, because they are what you call an ACO. And this is something that maybe if people are going into assisted living or long-term care, they need to ask, and that is an accountable care organization. This is going to be mandatory for everybody in 2029, but Team Health has picked it up as of 2025, and we have many things that we are accountable for making better for our patients. And deprescribing is absolutely one of them. And trying to decrease the amount of opioids people are taking. And so I think that we have, a leg up on a lot of facilities that don't have to do that because it takes
Yeah.
more work
Right.
and more time with the
Yeah.
patients,
Yeah.
and utilization of, other specialties and things that are available to them.
Yeah.
It's
For
so,
sure.
that's a good thing.
All right. Well, enough about work. I want to dive
Yeah.
more into how you, as a thriving 76-year-old, attack aging. So what is something that you understand now about aging that you did not expect?
I always thought that people had ailments because they just didn't want to do things. However, you know, as I get older, I find how really difficult some things become. And if you don't address it, it's not going to get better. And balance becomes an incredible issue, whether you want it to or not. I remember a couple of years ago, my granddaughter wanted me to jump rope with her. Well, I hadn't jumped in a long time, and I thought, well, I can do that. I tried in my kitchen to just jump, and I couldn't jump. I
Uh,
thought, what the heck?
okay, wait. How old were you, Kevin?
I was like 73, 74. And
Were
I
you?
thought, I can do this. And then I couldn't anymore. Then I had this incredible physical therapist who I said, I need to be evaluated. This is unbelievable. And balance was huge. And one
Yeah.
exercise that you gave me was, to jump up with your
Yeah.
hands on a counter. And I thought, the more I do that, the better I feel. And
Yeah.
by myself, I can actually do that.
Yeah.
So, I mean, it's just that. The other interesting thing that I've found, and I think this is really important, and I work with this
Wait,
with
so
my,
shameless plug. I gotta just like put in a shameless plug here really quick. So
okay.
would you say that it is a possibility to jump at the age of 76?
Oh, no question. Yes.
Yes.
But if you haven't jumped for 15 years,
Right.
you don't realize you can't jump anymore
Right.
because you just don't
Right.
use those muscles.
But
Or
after you lose it, can you get it back?
heavenly days, yes.
Yeah.
I mean, I can't wait till this summer because I'm going to get that little girl and I'm going to say, hey, Missy, when are we going to jump rope? And
She's
she'll
ready
go,
for you.
you can't jump rope. I'll say, oh, you just try me.
She's ready. I love
She is
that.
ready. I
I love
know.
that.
You know, the other interesting thing that I found is that working over the years, I wear flat shoes to work. And
Hmm.
I never really realized until, I wasn't dressing up as much and all of that. Going back to high heels is a horrible thing.
Yeah, they should be taken off the market. I don't
They
understand
absolutely should. Or when
for
they
so
see
many reasons.
somebody come in and you're a little older, they'd say, you know what? These are not for sale for you. I'm
Yeah.
sorry.
No, I don't think that that should happen because that's very ageist, right? I think that they should gently sway literally everybody away from high heels, right? They're just
Oh,
not good.
I totally agree. And I have a neighbor who is 92 and she still wears little heels. And I say to her, that you're going to fall and break your head, crack your head open. She goes, no, I won't. I've always worn heels. She was a model. And
Oh
as long
God.
as I've known her now, 18 years, she's always worn heels.
You know what though? I love that for her. She probably looks great.
I love it for her too, but she walks hunched over and I'm so afraid she's going to just fall. But, I mean, and I tried to explain to her, there's a thing called proprioception.
Yeah.
And that's when you have to be able to feel the ground with your foot. And I
Mhm.
said, how do you feel the ground with your foot when you got a heel up on it? She goes, oh, I never thought about it that way. But you just hold on to things as I walk.
Oh my gosh.
Oh, so anyway, I know, right? So anyway, I
Yeah.
try to be her role model.
I love that. I love that. Well, speaking of being a role model, because you are a role model for everyone that is aging after you, what do you wish people in, say, their 50s or their 60s knew about getting older?
I think, there's a saying, use it or lose it. And I think people laugh at that. But it is so true. And, you know, you, if you don't move, I mean, and jumping rope is a very simple thing,
Mhm.
and balance. I mean, the other thing that little granddaughter taught me was, I bet you can't put your leg up and stand on one leg. I said, I
Oh,
bet you I
challenge
can.
accepted. Challenge
Yes.
accepted.
Well, it was at the time when you had a balance challenge going.
Oh,
And I got so much better. I was able to do 30 seconds on each side. And guess what? That little pumpkin couldn't.
I see. I'm telling you. I tell her every day. She needs to
I know.
practice.
She needs to practice. And
Yeah.
so then we didn't have a challenge anymore.
Oh, well.
But, you got to keep it going. It's just, things change and they change because our bodies change. And
Yeah.
if you don't change with them, you know,
Yeah.
you're not going to be healthy and you're not going to be your best self,
Right.
um, it's, It's really important to keep going.
Yeah.
You know, one thing as I age that I do that I think anybody can do it, get off that recliner. For instance, when I do the wash and I fold the clothes in the living room, I could take them to the bedroom, fold them there because that's where they belong. I do it in the living room. Then when I'm finished, I take my underwear to the bedroom, put it
Yeah.
away. I come back, I take my pants to the bedroom, put them away. Come back, take my tops to the bedroom and put them away. I could stack all that or put them in a basket and take it to my
Yeah.
room. But I've added probably 150 steps.
Yeah. Which
Just
is
doing that.
brilliant. And that's actually what we train people who are new to exercise, who have never exercised before. What you're doing is actually a term called habit stacking, right?
Oh,
So when you are trying to initiate some form of exercise into your life, if we were to tell somebody, okay, get yourself to the gym 30 minutes, 3 times a week and do functional exercise, they're going to look at you like, you're insane, right? There are younger
right.
people your age that are throwing weights everywhere. They're grunting, they're running around like, I'm not going to the gym. And then when you make a goal that intense, like 150 minutes a week for someone that does that exercise is
Yeah.
aggressive, right? So we teach people that concept of habit stacking. So if we're working on their balance, we say, okay, well, here's the skinny. No matter what, you're going to brush your teeth once, hopefully twice a day for those dentists
Correct.
there, right? So if you're doing it appropriately, you're brushing your teeth for 4 minutes a day. Well, why not incorporate 4 minutes of balance exercises while you're brushing your teeth, right? So something as simple as like standing in a tandem stance while you're brushing your teeth, or standing on one leg while you're brushing your teeth. Habit stacking, right? Incorporating exercise into the things that you already do. So that's brilliant. Brilliant.
You know, I mean, I do that, especially if I take something downstairs.
Yeah.
My rule is one thing at a time,
I love that.
no matter where it goes.
Yeah, that's great.
But you know, the whole brushing your teeth and balance thing, I started doing that as well. And when I lift my leg up, I just lean my knee against the counter if I
Ooh,
think
yeah.
if I think I'm gonna fall.
Yeah. Brilliant.
So, you know,
Absolutely.
it helps.
That's
But
great.
some days I don't feel like doing it. I'll be honest.
That's okay. But it's on those days that you don't feel like doing it, you remember why you're doing it, right?
Absolutely.
Because you don't want to fall while you're walking into a dance competition, or fall while you're walking up the bleachers to a futsal game, right? You want to
No
be balanced,
question. You
for
know,
sure. You
and
want to
I
be
don't
able to
want to
walk
have to
those
hold on
beaches
to the
of
rails like
Mexico.
this.
Yeah, no, we don't want that. No. So this is also a great segue. What does aging well look like to you? Like what do you think that, in your last decade of life, whatever that may be, if you have done it well, what does that look like?
It looks like getting up every morning, getting dressed, walking about without a cane or a walker, and a smile on my face. And honestly, a plan for every single day.
Mm.
You know,
Oh,
one of the ways
yeah.
I can get to sleep, because sometimes things race in my head, is to review my to-do list and what are my priorities for the next day.
I love
If
that.
like when I retired and everybody said, "Oh, retirement, you can do nothing." I did nothing and I deteriorated. There's no
Yeah.
question about that. Um, it's and you have to have purpose in life, purpose in your day, and it can be anything. It doesn't have to be, oh, what do I have to do today? But it's always, being mindful of movement.
Mhm.
And if you're not, you can't age gracefully. I just
Right.
don't believe that you can.
Right. Right. So now in your line of work, you've seen firsthand what happens when
Mhm.
people chalk things up to, oh, this is just because I'm getting old, right? That internalized ageism. From your perspective, why do you feel as though that belief system or that mindset is so damaging? And what do you wish that more people understood so that maybe they could keep themselves out of an institutionalized situation like where you work. I say institutionalized like it's a negative thing, but really there are lovely assisted livings out there that I would sign up
Yeah.
for tomorrow.
Yeah. I mean, I work at one that I would live in actually.
Mhm.
But you know, when so much people think that things that are happening to their body are normal aging changes, they really aren't that at all. You know, yes, our bodies change, but actually most things are treatable. And people don't realize that. It's not only the people I work for, it's the people, my friends, my neighbors. You
Mm.
know, they just go, oh, I can't believe you did that work. Blah, 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 blah. But, you know, I don't think people understand that delaying treatment or acceptance of what's going on is much more damaging. You know, diagnosing, treating, and prevention can actually lead to, you know, unnecessary loss of independence and quality of life.
Yeah.
And the biggest example is, I think, my work, my that I did it with urology in both men and women. You know, I think number one, men don't look at um, not being able to pee well, hesitancy and urgency and all that as just, oh God, I'm old. You know, what am I going to do with this? Getting up more at night, blah, blah, blah. If they saw a urologist sooner, they get that prostate taken care of. And there's so many things that are not surgery at this point, and that people don't even know the advances in medicine. But urinary incontinence in women is probably one of the most dangerous things anybody can have for so many reasons. One, you're peeing on the floor, it's wet, you're going to slip, you're going to fall, you're going to break a hip, you're going to be dead in a year. And I know that's, you know, extreme, but I don't know that people realize 50% of older adults over the age of 80 that fall and break a hip are dead within a year.
Yeah.
And it's
Mhm.
because they don't listen to people like you.
Yeah.
They sit around because they have too much pain. They don't want to move. They don't
Mhm.
understand that movement is what's going to get them better.
Yeah.
And, you know, there's skin issues, and there's just so many, there's social issues with
Yeah.
incontinence, there's sleeping issues if they're up, and there's so many behavioral things that can just be done for those types of people, and they don't realize it.
Yeah.
And, you know, if I swear, and I don't like to toot my own horn, but almost every week when I go to work, somebody will say, you know what? I never knew that I could do that and I wouldn't pee so much. I never knew that.
Yeah.
And I'm
Yeah.
like, it's great, isn't it?
Right.
Yeah.
And so simple.
It is so
Yeah.
simple.
Yeah.
And, you know, people like you, they can come to, and, you know,
Mm.
if they're not able to do something and you just say, so what is your bladder like? Do you leak urine? Oh, yeah, but you know, I've done that for years.
Yeah.
Well, maybe that has something to do with what you can't do now
Yeah.
or you don't want to do,
Right.
you know, and I just think it's just so sad.
It is. And I think that what we see and what we bump into a lot is trying to with mindset, right? And the like, oh, I'm falling because I'm just getting older and all of my
Yeah,
friends are falling, or, you know, of course I would have knee pain. I'm old and I have arthritis.
right.
I think that the big soapbox that I'm always getting on is just because it's common doesn't mean
Hmm.
that it's normal.
Right.
And just because it may be normal doesn't mean it's preventable. So like, yeah, as we get older, our muscles start to lose mass and strength and power. that is a normal process of aging, and it's called sarcopenia.
Yeah.
But it doesn't have to happen that way, right? I
Right.
mean, there's a whole senior Olympic games, right? Where there's like
Mhm.
almost 12,000 senior athletes running sprints and doing all kinds of senior sporting events. They realize that like it may be normal and it may be common, but it doesn't have to be my life. I think is that mindset shift that we try and instill in people.
Yeah, I agree with you. And I mean, I don't know if you saw recently on TV about this, the lobster lady in
Oh my
Maine.
gosh, I did see this. She's like
Oh
an
my
icon.
105, and she
I
just
know.
gave up her lobster license 2 months ago.
Yeah. And what did they say too in that story? Like she gets up every morning and she puts on makeup and
Yes,
earrings to go
absolutely.
like catch lobsters on a boat.
Right.
I would
And
be like,
it's
no
been
thanks.
her family business forever.
Yeah, I
I
love that. Talk about
mean,
purpose, you know?
yes, absolutely. I
Yeah.
mean, should be everybody's idol.
Yeah, I would agree. I would agree. But speaking of idols, I think you would be a good person to look up to for individuals that are aging and they feel stuck or unsure about their next chapter, because I know from knowing you personally that when you did retire, you were feeling stuck.
Hmm.
So what advice would you give to anybody that is feeling stuck? Because I think that is a super common experience in individuals after they retire, or any type of big life change that happens as we age, right? I mean, no longer are we going to baby showers and weddings, we're going to funerals.
Right.
And, things are just changing so much as you get older. So what advice would you give to those people that maybe it's a big life event that makes them feel stuck, or maybe it's not. Maybe it's just they've just gotten into a rut. What would you tell them?
Yeah, I would tell them you need to reach out to friends and family. You need to look into what is available in your community to maintain activity. Senior centers, have everything. And I don't think people realize that. I recently had a friend say, "Oh, I don't want to join that with you because it would make me feel old." And I just come visit it with me.
Yeah.
And um, so she went there, and we saw people our age and younger playing cards, sewing,
Yeah.
doing all the things that you can do at home by yourself if you want to be, you know, an isolationist, or you can do it with other people. You can do it with purpose.
Yeah.
And so we came away from there, um, joining, and now we're going to learn to play mahjong.
Oh my
So,
gosh. Yes. I love
and
that. I hear
so
it is so challenging.
I know, and I've played it with my old high school friends the last couple summers when we get together. We just play it for 2 days, for two
Oh my
full
goodness.
days. So, another friend plays it, and she's pretty much a master. She's going to teach us and
Yeah.
do it. So I'm
I
so
hear you. Yeah, I
excited.
hear you need like a teacher to get into it.
Oh, you absolutely do.
Okay.
You can't learn it by yourself. And if you don't
Okay.
play, you forget what all the little icons mean.
Okay. Okay.
And
Interesting.
even younger people are learning it. It's
Oh,
crazy.
this is where I got it from. My girlfriends. I want to do like a mahjong night.
Yes, it's
I
fabulous.
don't know how to play, but
Well,
I'll
you can
learn.
come play with us.
Done. Fine.
All
I'm
right,
in.
awesome. Okay.
All right. What role has your family played in your aging journey?
Well,
You can be nice to me.
um, my what?
I said you can be nice to me.
My parents um were actually opposite ends of the spectrum. And I learned hard lessons from both of them. My mother passed away, like I said, at age 62 from a precancerous condition that she just didn't want to be treated for. Um, and unfortunately passed away 6 months after her diagnosis. My father, on the other hand, was remarried, happy, and lived a very active geriatric life. He was a heavy former smoker and drinker until about the last 20 years of his life. His death was sudden, what was thought to be cardiac related. My whole life, I have worked very hard at avoiding all my parents' chronic diseases in order to continue to do the things that I love. I mean, as my father, when he got remarried, he even said to me, I wish I was doing these things when I was younger. I wish I had stopped smoking. I wish I had stopped drinking. He was a very heavy drinker and a heavy smoker until they found a spot on his lung, but that never turned out to be anything, but he still quit. But, when you do all those things into your 40s and 50s, it's hard to, it's hard to not have those chronic illnesses that happen because of that show up.
Mm-hmm.
You know, I saw what complacency can do to one's mind and body, and that was my mother. But I also saw firsthand what doing what you love and maintaining activity and relationships can do to quality of life. And, in addition to all of that, I've learned in my personal journey that continuing to maintain a healthy body and mind and learning new things does wonders for the brain, no matter what bad things come your way. And some people have more bad than good, but you know what? You still have to get up the next day and be grateful that you do have a plan and just do it. And my family, my daughter, who you know well, has followed in her father's footsteps and in looking at adults maintain their health, their wellness, their mind. And to me, that's the best gift that she could have ever gotten.
Oh, Mom.
So
Listen, it's a blessing and a curse, right? Because you feel like everybody should be doing, following your advice and doing what will work.
right. And it's really hard until they see, how come you can walk up steps without holding on to the rail?
Yeah.
And I said, well, secretly, I walk close to the rail. I don't hold on to the rail, but in case I would slip or something, I've got the rail to hold on to. I'm not going to fall down the stairs.
Right.
And, that's just a simple thing, but
yeah,
too many people take the elevator.
You're right.
That's crazy,
right.
but,
Now, if you could go back and tell your younger self anything at all, what would it be?
Don't drink Diet Coke.
Yeah. All right.
I'm totally dead serious.
Okay.
Because I've had cancer 3 times in a 3-year span. And I'm convinced that Diet Coke did that to me.
Yeah.
And I feel like it also fogs your brain. I feel like it causes a lot of swelling, edema, all that kind of things. And it doesn't help you lose weight. It
also causes bone breakdown. So
yes, exactly.
Osteoporosis.
I know it's just bad. The saccharins, all of that. And if people are using, those old sweeteners still, they need to get away from that and just put a little bit of real sugar. Or if you have to sweeten something, a half a teaspoon of sugar isn't going to throw 5 pounds on you.
Yeah. Yeah.
All
right. Rapid fire 3 questions to wrap up. Are you ready for it?
Kind of.
All right. What are you doing today for your brain health?
I am doing crossword puzzles. I am doing other, I do solitaire. I do things that keep me going. But one of the things that I have found works the best is, you're going to think this is crazy. I don't take the same route to where I go all the time. I
That's
take
great.
different routes
That's great.
because I don't want to get dementia and still be able to go to Leppings. And people will say,
Yeah.
well, you're fine. You go to the grocery store.
Yeah. All right. Well,
So
now we know. Now we know if you really do start to get lost, it's time to call in some reinforcement.
yes. And you know what? I like to keep conversations going with my grandkids. I have them from age 8 to 23, and they all have different things and different views.
Yeah.
And that keeps my mind going. I love
Yeah.
that.
I love that. All right. What are you doing today for your physical health?
I get up every morning, and this is crazy. A pharmacist that I once worked with told me that if you get up and drink 2 cups of water before you do anything, you'll have more energy in the day. I said, come on, what's wrong with my tea? She said, try it. I
Mhm.
tried it, and
Yeah.
I can tell you when I don't do it, I don't have any pep in my step. I
Yeah.
don't want to exercise. I don't want to. That call was my friend. Um, are you done with your interview with Jenna yet? And
Yeah.
we're going walking, and
Oh, I
you
love
just
that.
find other things to do. So
Yeah.
I maintain walking. It's hard in the snow, so I walk around the
Mhm.
house, I go to the
Yeah.
mall, do those kinds of things. And when I go to Meijer, I don't go get my stuff. I start at the home section and go in and out every aisle until I get to the food section, and then I
Yeah.
get what I need to get.
Yeah.
But I try to do my exercises. I would love to tell you every day, but I don't. And you know what? When I don't, I feel terrible.
Yeah.
For instance, when I'm in a car all day, it's like, what can I do? And so I just try to do little
Yeah.
the things that I do with my weights. I just try to
Mobility.
keep my everything moving,
Yeah.
because the more you move, the better you feel.
You're right. You're right. All right. Last question.
Yeah.
What are you doing today for your spiritual health?
Today for my spiritual health is what I do every day. When I go to bed, I say a prayer. I thank God for everything that He has given me. I thank the Blessed Virgin for all the tips that she's given me on being a mother. And I ask the Holy Spirit to help me learn better things when I've not done something that probably I should have done that day. And I
Yeah.
fall asleep.
I love that. I love that. All
So
right. Now, just to wrap up, this conversation, the intention of this conversation is to reach adults just like you. What do you hope is one thing that our community gets out of this conversation?
choose connection over isolation,
Love that.
and connection with friends, families. Get help. If you can't do something, find somebody that can help you do it. I think motivation comes from the environment,
Yeah.
which includes all sorts of things: friends, family, weather, living space, and opportunities. Let me tell you, I can look outside every day and say, oh, it's snowing again, I'm not going to be able to go walking. But that's insane. There's so many
Right.
places you can walk.
Right.
And I just think, take advantage of opportunities. When people ask you to do something with them, try it out.
Yeah.
If you don't like it, just say, I didn't like that. But
Yeah.
try it out. Don't make assumptions. So
I love that. I love
make
that.
one positive change in your life
Yeah.
and keep your goals as simple as possible.
I
For
love that.
instance, and I think, like you said, you talked about the stacking. And
Yeah.
I think, you know, if you want more steps in your life, just add them by putting things away one at a time. Like I said,
Mhm.
just do one thing.
Yeah.
If your goals are, I'm going to lose 10 pounds in 1 month, because I've been there, not done this.
Right.
That's not going to happen.
No, it's not.
If
Right.
you lose
You're
a
setting
half a
yourself up
pound
for
a
failure.
week, that means you're maintaining a good diet.
Yeah.
Go for it.
Yeah.
Just be reasonable.
Yeah. Well, thank you so much for taking the time out to chat with me for so many reasons, right? Like, I don't feel like we get to have an hour of uninterrupted chit chat very often anymore. So this was
Exactly.
nice.
And I didn't even
And I
hear old
think,
Coley.
no, I know he's being kind of quiet, but I think that your experience and your insight into aging is going to be invaluable for our listeners. So I appreciate you sharing all this stuff with us.
Well, I appreciate you asking me.
Yeah.
So
All right, girl. Now go get your walk in. All right.
I am.
And
I will. I'm calling right away as soon as we are finished.
okay. And do some lunges.
Yes, that's the other thing I
Mhm.
do when I get up from a chair. I do
Yeah.
a half a dozen squats.
Perfect. All right. And then
All
we'll
right.
talk about that exercise program next time we
Okay.
talk.
Perfecto. Thanks,
All
honey.
right. Thanks, Mom.
Love you.
Love you too.
Bye.
Bye.